Everyone, for today, we will be discussing about the concept of your calcium imbalances. So, ayan. So, isa pa rin to sa pinakamahalagang topic natin and then under your electrolyte imbalances. And in fact, this is the third biggest concept in the electrolyte imbalances. This is still part of our fluid and electrolyte series. And don't go away, of course, no? Because we'll be having a very important markers. Napakarami po ditong mga medications, napakaraming mga markers, and even the pathognomonic signs na dapat ay alam natin. Okay, let's start this right here, right now. Okay, let's talk about your hypocalcemia. Now, kapag sinabi po nating hypocalcemia, it is your serum calcium level that's lower than 9 milligrams per DL. Okay, kapatid, kapag sinabi nating calcium, ang the normal value that we have for your calcium is 9 to 10.5. Okay? So, the 9 to 10.5 milligrams per DL ay nagva-vary po ito, no? Base sa iba't ibang mga references that we have. But of course, both the NCLEX and PNLE will be fair to you as they will be giving you those numbers that are really, really significant. Okay? So, masyadong malayo sa lower limits and of course also on the upper limit. So kapag sinabi nating hypocalcemia, kapatid, it's a serum calcium level that's lower than 9. So ibig sabihin bumaba siya. Masyadong mababa. That's why it's hypocalcemia. Okay, so ngayon alamin natin ano ba yung mga dahilan kung bakit nagkakaroon tayo ng hypocalcemia. Okay, let's start talking about your causes of hypocalcemia. First, we have low calcium absorption in the GI tract. Tandaan natin, kapatid, na ang inyong calcium, okay, halimbawa sa mga kinakain mo, o iniinom mo, halimbawa, we all know this thing, alam natin, no? It's a public knowledge and it's a very, very generic knowledge na ang milk class, mayaman yun sa calcium. That's correct, kapatid. Now, after you have consumed all those foods, drank all those consume all those milk and other food and other supplements na mayaman sa calcium, kapatid, i-absorb yan sa GI tract natin. So, ngayon, dahil may mababang calcium absorption in the GI tract, it's possible no, na magkaroon tayo ng hypocalcemia. Okay, first, that's one, the low calcium absorption in the GI tract. Next, kapatid, is we need to remember that this is an NCLEX PNLA favorite. So again and again and again, remember that your calcium is absorbed in the GI tract. Okay? Now, pangalawa, increased calcium excretion. So aside from the cause, no, kapatid, na mababa yung absorption ng ating calcium sa GI tract, remember that it is also excreted via the kidney, via the GI tract as well. So, dito, ang nangyayari is nagkaroon lang ng increased calcium excretion. And that's very, very dreadful and dangerous, kapatid, because it may lead to hypocalcemia. Okay? So, second na cause ng ating hypocalcemia is the increased calcium excretion. Number 3, kapatid, is the decreased ionized fraction of calcium. So, we need to remember that when we say ionized fraction of calcium, these are those calcium, kapatid, that's freely, no? Freely circulating in the body. So dito, kapatid, there are some cases and there are some situations or conditions that leads us, no, to decreasing the ionized fraction that's available in the bloodstream ng isang tao. So that's another cause and that's another way for us to have a hypocalcemia. Okay, so now we need to discuss one by one kung ano ba yung mga specific conditions, kapatid, that causes your hypocalcemia. First, let's discuss yung low calcium absorption in the GI tract. Kailan at paano nga ba nagkakaroon ng low calcium absorption in the GI tract? Okay, first, let's talk about kung mismo meron tayong low calcium intake. So, we need to remember this one. Halimbawa, ayaw mong kumain, kapatid, ng milk, ayaw mong kumain, kapatid, ng mga calcium-rich food or even nagka-fasting. So, what are you gonna absorb kung in the first place wala ka ini-intake? Okay? So, low calcium intake. Pangalawa, kapatid, is lactose intolerance. So, yung mga tao, kapatid, na kung saan meron silang problema with dairy products, such as, say, for example, your milk, your cheese. Okay, nagkakaroon sila ng tinatawag nating condition na lactose intolerance. Okay? So, we need to remember na milk is a rich source of calcium. So kapag wala masyadong intake ng lactose rich products, no, it may lead to your hypocalcemia. Pangatlo, kapatid, is yung tinatawag nating mga malabsorption syndromes. Again, we need to remember, kapatid, that your calcium is absorbed in the GI tract. So, kapag may problema yung GI tract natin, probably, no, magkaroon din tayo ng problema in our calcium level sa buong katawan natin. So, ano ba yung mga malabsorption syndromes na yun or yung mga absorption condition natin sa katawan which may lead us to a problem of having a very low calcium levels? Number one, kapatid, is yung tinatawag nating celiac disease. Sa celiac disease, anong nangyayari? Okay, sa celiac disease, there is this what we call as lack of villus area in the GI tract. Okay? So, dahil sa GI tract po, again, ina-absorb natin and in your celiac disease, there is a lack of villi, okay? Or the villus area. So, walang masyadong absorption na magaganap. Okay? Hence, it will lead to your hypocalcemia. Pangalawa, okay? Yung Crohn's disease na sinasabi natin. Okay, when we say Crohn's disease, it is actually one of your IBS or irritable bowel syndrome. So, it is an inflammatory bowel disease, kapatid, na kung saan, no? Because it's an IBS, nagkakaroon tayo dito ng inflammation. Okay, so, now, anong problema natin? Because of the inflamed lower GI tract, bumababa rin ang absorption capacity, okay, ng ating pong GI tract. So we need to remember that these two concepts are both NCLEX and PNLA favorites. Tandaan po natin yan, kapatid. Okay, double letter C, your celiac disease or Crohn's disease may cause your hypocalcemia. Remember that one, class. Okay, another thing is your inadequate intake of vitamin D. Bakit po vitamin D? We are talking here about your calcium. So we need to remember that your vitamin D increases absorption of calcium in the GI tract. So, shortly saying, and we're very, very safe to say that the increase of vitamin D will also increase your calcium levels in the body. So, we need to take more and more and more and more vitamin D, okay, for us also if we want to elevate our calcium levels in the body. Okay? So, remember this thing. This is also an NCLEX and PNLA favorite. Another condition also is the end-stage kidney disease. Why? Because when we have this end-stage kidney disease condition, kapatid, is that posible din, no, na there would be more and more excretion of your calcium in the body. We need to remember that, kung mapapansin po ninyo, even in our previous discussions of electrolyte imbalances, your kidney disease is either in the hypo or hyper conditions. It's because nga, kapatid, kapag meron tayong kidney disease, the effect could be you will be excreting more or you will be retaining more. So, for this one, kapatid, you will be excreting more. Why? Because CKD, okay, causes hyperphosphatemia and decreased production of vitamin D. So, this is a condition wherein kapag mataas po ang ating phosphate levels, we need to remember that your phosphate and your calcium are indirectly proportional with each other. So, ang pagtaas po ng ating calcium ay siya namang pagbaba ng ating phosphate. Upon the other hand, ang pagbaba or pagtaas po ng ating phosphorus, siya namang pagbaba ng ating calcium and vice versa. Okay? So, another condition then that might happen in your kidney disease or your CKD is there will be a decreased production of vitamin D. And we need to remember that your vitamin D is the one that's increasing absorption of calcium in the GI tract. Okay? So these are the causes wherein you will have, okay, low calcium absorption in the GI tract. Okay? So let's talk about another cause, which is increased calcium excretion. So ano nga ba yung mga condition, kapatid, na kung saan nagkakaroon tayo ng increased calcium excretion? Okay, first is yung tinatawag nating polyuric phase of your kidney disease. So kapag sinabi natin polyuric, so ibig sabihin maraming lumalabas dito na urine or you are losing more and more fluids and electrolytes in the body. So it's the phase wherein masyadong active pa, no? Okay, ang ating kidney. So ibig sabihin, kapag you are excreting more and more fluid, you might be excreting also more and more calcium. Okay, another cause is your diarrhea. Again, because your calcium could be excreted both in your kidneys and the GI. Okay? Now, let's have also another cause here, your steatorrhea. When we say steatorrhea, kapatid, okay, it's a condition wherein nagkakaroon po tayo ng depletion of fat-soluble vitamin D. Okay? Thus causing your calcium deficiency. Okay? Tandaan niyo steatorrhea kapatid, it may cause your vitamin D, okay, depletion. Hence, magkakaroon po tayo ng calcium deficiency dito kapatid. So we need to write down, okay? This one. Now, another condition kapatid is your wound drainage, especially of the GI tract. Okay? Sa mga nagkakaroon ng suctioning, no? Or drainage, okay? In your GI tract, we need to remember that it might also cause your hypocalcemia. Okay? Next is your decreased ionized fraction of calcium. So, ito naman, medyo marami dito mga conditions. So, what are those conditions that can cause your decreased ionized fraction of calcium? Okay, so first, let's have your hyperproteinemia. We also have your alkalosis. Okay, bakit sa alkalosis kapatid? Alkalosis promotes the binding of calcium to albumin, which reduce the fraction of ionized calcium in the blood. So we need to remember this one. Okay? So nangyari kapatid sa alkalosis, nagbabind po ang ating calcium to our albumin. Okay? At nagkakaroon tayo ng reduced calcium levels in the blood. So, yun, ang condition na kung saan bumababa ang ating ionized fraction of calcium in the body. Number 3, kapatid, again, here's steatorrhea. Calcium binders, alam natin yan. Acute pancreatitis is also one. Why? Because in your acute pancreatitis, kapatid, nagkakaroon tayo dito ng saponification of your calcium, okay, due to release of the pancreatic lipase. Sa madaling sabi kapatid, nako-coat po yung ating calcium. Okay, it's because of the release of your pancreatic lipase. So that's a condition wherein it can decrease our ionized fraction in the blood. Okay? So another condition is of course your hyperphosphatemia. We need to remember that these two kapatid is inversely proportional with each other. So calcium and phosphate or phosphorus, they are inversely or indirectly proportional with each other. Okay? So another is also the removal of your parathyroid gland. So ano naman ang kinalaman ng ating parathyroid gland dito kapatid? So your parathyroid gland here, okay? This gland regulates the calcium levels in the blood. So kapag na-remove po ang ating parathyroid gland, so we need to remember that it may cause, okay, your hypocalcemia again because wala na po masyado magre-regulate ng calcium levels in the blood, okay? So, the parathyroid gland removal. Now, let's talk about your assessments na makikita natin sa pasyente na mayroong hypocalcemia. Okay, ano nga ba? Starting with your, number 1 is your bradycardia. So, remember kapatid that your calcium is actually one of those electrolytes that causes the pumping of the heart or the harmonized pumping of the heart. Yun yung pinakatamang term no? So, isa sa mga halagang may napakahalagang role in the pumping of the heart is your calcium. That's why kapatid, kapag meron tayong masyadong mataas na BP and also nagkakaroon tayo ng dysrhythmias, okay, or arrhythmias. So, ibig sabihin, no, in those times we're in, irregular po ang pumping ng heart is binibigyan natin ng pasyente ng ating tinatawag na calcium channel blockers. Why? It's because the patient might be having too much lang din ng calcium. Okay? So dito kapatid, one of the causes or one of the assessments na makikita natin on a patient na nagkakaroon ng hypocalcemia is bradycardia. Okay? So ibig sabihin, mababa yung calcium, walang masyadong nagbibigay ng cause or ng electricity or electric power for our heart to pump. Okay? Now, number 2 is your hypotension. Okay, hypotension po ang dahilan. So, bradypnea as well. Why nagkakaroon tayo ng bradypnea? It's because your calcium actually, or your low calcium levels will affect actually your skeletal muscles. Okay, including those muscles class na located sa inyong, okay, lungs. Okay, remember that one. Next is nagkakaroon tayo ng twitches. Another also, yan. This is very, very pathognomonic to your hypocalcemia. Nagkakaroon po tayo dito ng tetany. At itong dalawang malalaking konsepto, this has always been asked both in the NCLEX and PNLE about your hypocalcemia. First is the Trousseau sign, which is, okay, and also your Vostok sign or Chvostek sign. Okay? So, remember these things na number 4, 5, 6, and 7, yung twitches, tetany kapatid, positive Troso sign and also your Vostok sign. Why? Because these are both NCLEX and PNL favorites, especially si Troso sign. So when do we how do we call it? When do we determine if it is Trosos or Vostok sign? Because minsan ito silang dalawa class nakakalito. So we need to remember that your Troso sign is a condition wherein nagkakaroon tayo ng involuntary twitching po dito po sa ating upper part of the arm upon putting, okay, our cuff or BP cuff, okay? So we need to remember that one. Next is your Vostok sign wherein we try to trigger our cheeks, okay? So, involuntarily, nagkakaroon din po tayo ng twitching dyan. So, that's what we call as your Vostok sign. Okay? C, cheeks for Vostoks, and then T, taas ng kamay for your Troso sign. Okay? Another is, we need to remember, nagkakaroon din tayo ng hyperactive bowel movement dito po sa ating hypocalcemia. So, kasama na yan, hyperactive bowel, diarrhea, okay? And also increased peristalsis. So, you need to remember this one. Hyperactive po kapag meron tayong hypocalcemia. Okay? So, when trying to remember the things that are present in your hypocalcemia, we need to remember the biggest T's here. The twitches, tetany, and also your trosos. Okay? And of course, wag po natin kalilimutan ang ating Vostok signs, which is makikita po natin on the facial area, specifically on the cheeks of the patient. Okay? So, it can be assessed there. Okay, so also we need to remember to watch out for signs of respiratory arrest because of your tetany. So we need to remember that your number 3 here says na pwedeng magkaroon ng pasyente natin ng bradypnea. So kapag meron po tayong shallow and weak muscles in the respiratory area, okay, that assists in our breathing. So that's where we put our patient very, very at risk for respiratory arrest. So we need to assess and monitor our patients for signs of this one, okay, very carefully. Okay, so let's continue with your ECG changes. What are those ECG changes that can be seen in your patient experiencing hypocalcemia? Okay, first is nagkakaroon tayo ng prolonged ST interval. Dalawang prolonged to, kapatid. And number 2 is your prolonged QT interval. So we need to remember this one. Again, prolonged ST interval. And the number 2 is your prolonged QT interval. Okay, so what are we gonna do to our patient experiencing hypocalcemia? So let's talk about your interventions. Okay, first, kapatid, of course, mahalaga that we should monitor the vital signs of the patient. Okay? So, it encompasses all. So, lahat po ng mga bumaba at tumaas, we need to monitor those. Again, I said in our assessments that it's very important for us to monitor, kapatid, our respiratory system because the patient might be, okay, experiencing now your respiratory arrest. So, monitor the vital signs of the patient. Pangalawa, place the patient on a cardiac monitor. Why? Because we have our ECG or EKG changes. Okay? Number 3, ayan. Number 3, kapatid, we need to administer calcium. Why? Because mababa ang ating calcium levels dito. So, we need to administer or give our patient oral or IV calcium. Okay? So, remember, for IV administration, we need to remember to warm the injection to body temperature. Okay? And also administer slowly, monitor for ECG changes, and monitor for hypercalcemia. So again, we need to warm the injection solution to body temperature before administering if it is given an IV. And also, we need to give it slowly, monitor ECG, and also hypercalcemia. Again and again, sabi ko sa inyo kanina, your calcium, kapatid, affects your electrical activity of the heart or the pumping ability of the heart. So we need to monitor our ECG changes, and also we need to give it slowly, okay? So that we would prevent more and more problems. Okay, so also, kapatid, we need to administer medications that increase calcium absorption, okay? So, what are these medication? Number 1 is your aluminum hydroxide, which reduces phosphorus levels. Okay? Hence, increasing your calcium levels. Okay? Again, aluminum hydroxide, which reduces your phosphorus levels. thus increasing, okay, your calcium levels. Okay? So, aluminum hydroxide, kapatid, it will increase, kapatid, the absorption of your calcium in the GI tract. Okay, another also is we need to administer vitamin D. Again, bakit? It aids in absorption of calcium in the intestinal tract. So aside from that, you have given your aluminum hydroxide, also, kapatid, you give your vitamin D, which aids in absorption of calcium in the intestinal tract. Okay? Also, this one, we need to remember that we give our patient a quiet environment. Why? Because the patient is now at risk of having tetany. Okay? So, we need to provide a quiet environment and also initiate seizure precautions to our patient. Okay? So, remember that both your NCLEX and PNLE are just safety exams. So, all of those options, kapatid, that will give our patient the safest answer. That's most of the time the correct answer. Okay? And also be careful when moving the patient. Why? Because the patient is now at risk for your pathologic fracture. It's because mababa nga ang kanyang calcium level sa katawan. So, we need to monitor also the patient for signs of your pathologic fracture, and also we need to be very careful when moving the patient. Okay? So, remember that one. Okay, and also you need to stand by calcium gluconate and also increase the calcium in the diet. So, when will be or when you're asking what are those food that are high in calcium, remember dairy products, milk, cheese, and those green leafy vegetables. So we need to remember these things here. Okay, you increase the calcium in the diet of the patient. Okay, this time let's discuss about the concept of your hypercalcemia. We're done with your hypo, moving to your hypercalcemia. So this is just too much. The serum calcium level here in your hypercalcemia is higher than the upper limits of 10.5 milligrams per DL. So kung kanina, masyadong mababa for 9, ngayon naman, kapatid, masyado lang din siyang mataas. Okay, more than your 10.5 milligrams per DL. Okay, so let's talk about the causes of those conditions that may lead to your hypercalcemia. So first, kapatid, is the increased calcium absorption in the GI tract. Kung kanina, mababa yung absorption, dito naman, it's just too much or increase. Okay? Number 2 is decreased calcium excretion. Hindi rin na ilalabas ang ating calcium sa katawan. Number 3 is increased bone resorption of calcium. Okay? So, normally, kapatid, your calcium should be located, kapatid, in your bones. Okay? So, whenever we intake food that's high in calcium, so it will be absorbed in the GI tract and it will be deposited to our blood, and supposedly, okay, normally it should be stored in our bones. Pero meron pa yung tinatawag na mga fraction, okay? Fractionated levels of calcium in our blood. At ang normal na amount lang dyan, that's your 9 to 10.5 milligrams per DL. But in the case of your resorption, okay, yung resorption po, kapatid, it's the process of wherein the deposited calcium that's located in the bone goes outside from the bone, lumalabas po siya, bumabalik siya sa bloodstream. So kapag nagkakaroon ng ganung condition, kapatid, tumataas po ang ating calcium levels in the blood, hence nagkakaroon tayo, kapatid, ng tinatawag nating hypercalcemia. Number 4 is also hemoconcentration. Okay? So we will be learning each one of these as we move forward. So let's discuss your first cause, the increased calcium absorption in the GI tract. So ano nga ba yung mga condition na kung saan nagkakaroon tayo ng increased calcium absorption in the GI tract? Number 1 is excessive oral intake of calcium. Yan, sobra lang din sa intake ng calcium. Okay, another din is your excessive oral intake of vitamin D. Again, because they are directly proportional to each other, because your vitamin D supports or aids in the absorption of your calcium in the GI tract. Remember this one. Kapag too much ang calcium, too much ang vitamin D, it will lead to your hypercalcemia. Okay, another is your decreased calcium excretion. Hindi masyadong nalalabas ang calcium sa katawan natin. Okay, so ano nga ba mga condition? First is your kidney disease. Okay, so another also, kapatid, is your use of thiazide diuretics. So, bakit dito nasama si thiazide diuretics, kapatid? Remember that your thiazide diuretics increases renal reabsorption of calcium. So, si thiazide diuretics po, it throws both your potassium and your sodium, but it increases the reabsorption of calcium in the kidney. So we need to remember that one. Okay? So this is now a connection wherein kapag pala nagbibigay tayo ng thiazide types of diuretics, kapatid, it will also reabsorb, okay? Or help in reabsorbing our calcium in the kidneys. Okay, so another is the increased bone resorption. So what are these conditions that supports bone resorption, ng pagbabalik po ng ating calcium from the bone back to the bloodstream? Okay, number one is your hyperparathyroidism. Okay, na another is your hyperthyroidism. Ayan. Number three is your malignancy. Yan, bakit nagkakaroon tayo dito ng bone destruction eh? So, because nagkakaroon po ng malignancy sa bones, nadidistract po yung bone, sorry. So, ibig sabihin, may tendency po na lumabas yung mga calcium natin back to the bloodstream. So, that's what we call as your resorption related to malignancy or bone destruction. Okay, number four is your immobility and then also your glucocorticoid. So, we need to remember, class, that these conditions, class, increases bone resorption or the deposition of your calcium from your bones back to the bloodstream, thus causing your hypercalcemia. Another also is your hemoconcentration. Kapag sinabi nating hemoconcentration, kapatid, these are the condition wherein masyadong malapot po ang ating blood, okay, because number one of your dehydration, okay, and then also, kapatid, ito, use of lithium. Why? Because the cause of lithium causes hyperplasia of parathyroid gland, thus increasing parathyroid hormone, which later increases your calcium. Remember that your parathyroid gland is one of those glands na, or the gland class that regulates your calcium in the body. So, our parathyroid hormone, kapatid, is directly proportional with your calcium. Kapag mataas po ang ating PTH, okay, which the use of lithium causes po the hyperplasia of your parathyroid gland, the gland that creates or produces your parathyroid hormone, it will later increase your calcium. Okay? The use of lithium, kapatid. We need to remember this one. Another is your adrenal insufficiency. Okay? Why? Because the reduced calcium excretion by the kidney and increased calcium entry to the blood circulation. Okay, one of the causes of those is adrenal insufficiency. Okay, so hindi masyadong nailalabas po ang ating kidney, ang ating calcium in the kidney, thus increasing calcium levels in the circulation. So we need to remember this one. Okay, so now what are the assessments na makikita natin sa pasyente na mayroong calcium? Okay, first, tachycardia. In reverse kanina sa ating pong hypocalcemia, nagkakaroon kanina ng bradycardia, but dito it's tachycardia. Another is hypertension, in contrast kanina na mayroon tayong hypotension. Bradypnea pa rin. Bakit, kapatid? It's because both your hypo and hypercalcemia, okay, affects your skeletal muscles. Okay, so we need to remember this one, due to skeletal muscle weakness. And the only difference that we have, kapatid, is that in your hypocalcemia, it's wherein there is a muscle weakness pero irritated po ang ating pong muscle, ang ating skeletal muscles. Upon the other hand, on hypercalcemia, your muscle is having this profound muscle weakness. So, ibig sabihin talagang very, very weak dito sa ating pong mabagal, no, in our hypercalcemia. Okay, so another also, it may lead to lethargy, coma, and even death, and we don't want that to happen. Okay, so mamaya sa interventions, we need to really monitor our patient. Okay, especially on this one, on skeletal muscle weakness, which affects our respiratory system. Why? Because in your hypercalcemia, we have this profound muscle weakness. Okay? Another, kung kanina hyperactive bowel, dito naman po hypoactive ang ating bowel. So, pwedeng magkaroon tayo ng constipation. Okay? So, wala pong masyadong peristalsis. So, now, let's know what are the ECG or EKG changes in our patient experiencing hypercalcemia. First is nagkakaroon po tayo ng shortened ST interval. Yan, shortened po ang ating ST interval, and also widened po ang ating T wave. Kung kanina, prolonged po, okay, dito naman may shortened tayo. Okay? So, what are your interventions for a patient experiencing hypercalcemia? So, isa-isahin po natin. First, of course, again and again, we need to monitor our patients. Okay, when monitor the vital signs of the patient, especially the respiratory system, it's because nga nagkakaroon tayo dito ng profound muscle weakness which leads to our kapatid respiratory arrest. Possible din po ang respiratory arrest dito. Okay? So also place the patient on a cardiac monitor because also it affects the activity or the pumping ability of the heart and also kapatid, the electrical activity of the heart. Okay. And we need to discontinue things here. Discontinue your IV fluids or medications which contains calcium and vitamin D because we don't want more and more calcium here. It's because mataas na po ang level dito ng ating calcium. Much more of your vitamin D as well. So, what are those medication? Okay, so you need to discontinue thiazide diuretics as well, kapatid. Okay, what are those thiazide diuretics? Okay, so thiazide diuretics are those ending with thiazide, yeah, like your hydrochlorothiazide. So we need to end those. Why? Kasasabi lang natin kanina, kapatid, that it's one of the causes of your hypercalcemia. Because your thiazide diuretics throws your potassium and also your sodium, but it creates more retention of calcium in the kidney. So we need to discontinue that. So what are we gonna use? So we will be using your loop diuretics. So what are your loop diuretics, kapatid? These are those ending with your nide. Yan, butaminide, bumex, furosemide, Lasix, and also your ethacrylic acid, edequine. Okay? These are your loop diuretics. Okay? Also, administer drugs that inhibits calcium resorption. Again, ang pag-transfer po ng ating pong calcium from the bones back to the bloodstream. So we need to prevent that to happen. Okay, so what are we gonna do? We administer drugs that inhibits calcium resorption. So what are those drugs, kapatid? Okay, so first is your phosphorus, okay, calcitonin, and also biphosphonates. So, kapatid, kapag sinabi natin biphosphonates, we have here your alendronate, fosamax, resedronate, actonel, yan. Prostaglandin synthesis inhibitors, which includes your acetyl salicylic acid and also your NSAIDs. So, what will happen, kapatid, if all of these things here fails? So, anong gagawin natin? So, if all fails to lower down your calcium, we need to prepare the patient for dialysis. Okay? So remember this one because it's the only way wherein we can also eliminate or excrete our calcium in the body. Okay? So prepare the patient for dialysis. So let's continue another and more interventions here. So we need to monitor the patient for flank pain. Why? Because our patient, okay, might be experiencing urinary stones, and to check the presence of these, you need to monitor the patient for flank pain. And also monitor for signs of pathologic fracture. Okay? And again, we need our patient to, when moving our patient, we need to be very, very careful. So let's have a practice question here, just before we end up our discussion in your hypo and hypercalcemia. Which of the following might have caused a hypercalcemia to a patient? Ano daw sa mga sumusunod no ang nakapag-cause probably of hypercalcemia? Letter A, increased physical activities. Letter B, acute pancreatitis. Letter C, wound drainage. Letter D, immobility. Your 5 seconds starts here. Okay, time's up. The best answer for this one, I know you got it right. The best answer for this one is immobility, letter D. Yan. So, let's try to explain this one. Letter D, immobility causes resorption of calcium to the bloodstream. So, it will increase your calcium levels. Upon the other hand, your A, B, and C are wrong because this option causes hypocalcemia and not hypercalcemia. Okay, maraming salamat po for being with me on this discussion of your hypo and hypercalcemia. So more and more discussion will be coming over. Just continue following our YouTube channel and also subscribe to our YouTube channel here. Maraming salamat guys and have a good day.